So welcome to, I think, week 6 of Maine Women's Lobby Bill Bites. We are waiting for Representative Perry, who has been detained, and hopefully she'll be joining us shortly. But in the meantime, let's go ahead and get started with Meagan Sway from ACLU of Maine. Hey, Meagan, do you want to say hi? Introduce yourself?
Hi. Hi, everyone. Thanks so much for having me. My name is Meagan Sway, and I'm the Policy Director at the ACLU of Maine. And I am working with Representative Perry and a bunch of other groups on what is still a legislative request, LR 933.
Great. And so just for folks, I see lots of familiar faces. So for people who are in the Zoom room with us, welcome. We're glad to have you. You're free to put comments in the chat. We'd love to take your questions and comments. And then for people who are on Facebook live stream with us, we are monitoring the chat over there as well. So definitely let us know what your questions are and let us know what you want to check in about. So
right. I just got a text from Representative Perry that she's having trouble getting into the room. So I'm going to quickly forward the email and then I will be right with you. Okay. Sorry about this.
Technology, right? It's so wonderful, except when it is not so wonderful. This is the cue for folks who are in the Zoom room with us to think about what you want to know about this drug decriminalization bill and pop it in the chat.
Great. So I just forwarded her the message. Let me just text her and let her know.
Great.
Okay, sorry about that.
No problem. All right, so we've got an LR. Tell us about it.
Great. This LR is an act to make personal possession of drugs a civil offense. And what this bill would do is it would take out the part of the Maine Code that criminalizes drug possession. And it would instead say if a police person finds you with drugs, that you are liable on a civil offense with a civil penalty, but not a criminal offense. And so what we're trying to do here is take away potential barriers to treatment and recovery for folks who want it. And another part of the bill also allows folks to access an evidence-based medical health assessment if they can't afford the civil fine. And that way, that's another way of trying to connect people with treatment if they want it, if they're ready. Anyone who would undergo this health assessment could waive the civil fine. And our hope is that that is a way of getting people out of jails and prisons and keeping them in their communities, potentially connecting them with treatment, with resources that are helpful to leading healthier lives.
So tell us a little bit about how the law currently works. So possession, is it a certain amount or?
Yeah. So drug possession by different weights have different penalties. Under possession of under 200 milligrams, oh, and I see Representative Perry is here.
Welcome, Representative Perry.
Thank you, finally made it. I had the wrong number altogether, so don't know how I did that.
Well, we're happy to have you here now. We were just talking about, Meagan was just talking a little bit about the bill, and we were talking about how it currently works with possession.
So I was saying that drug possession currently, if you have mostly under 200 milligrams of most substances, it's a misdemeanor for your first offense. And then over that, it's a felony offense. So a misdemeanor is punishable by up to just under 1 year in jail. or prison, and a felony is punishable by over 1 year. And so right now, the only way that you could not be criminalized is if a police doesn't arrest you, if a prosecutor decides not to prosecute, or if you get a deferred disposition.
Yeah. Yeah, and I think the difficulty is looking at substance abuse in general. The biggest way to perpetuate that is isolation. I think that's the reason why during this COVID stuff, we're seeing such an uptick in overdoses, is with that isolation goes an exacerbation of what keeps the addiction going. So we put somebody in jail, and if they're in county jail, which happens for the smaller ones, they don't get treatment. And so you've also got an exacerbation not only of isolation, but also of the fact that when they get out, they have no tools to stay sober. And that's when we see overdoses. And I have heard many in Health and Human Services, law enforcement say these people do not belong in our jails. They belong in treatment. It's going to cost us so much less. And I wish I had the figures for what it costs for a day in jail as a day in treatment. But, and not only that, we get them back into the community, we get them out of isolation and maybe to work. And then we have the benefit of what we lose when they're in addiction, and the cost to not only jail, but the health system, and also crime that goes along with that many times.
So your proposal strikes the crime for possessing. Is there still a certain amount? You know, I assume that there's a cutoff for, you know, if you're over or under.
Yeah,
okay.
There is. And I'm sure that will be discussed in committee. It's because I think I had one legislator I was looking at that was concerned that Class W drugs should be listed with that. Well, that's a discussion that has to happen, but it's not adverse to the others. So I think as we talk through this, I think we will find some, I'm hoping that we'll find a compromise that will begin the beginning of work of getting people to treatment. The other thing is, you know, we're asking them to go for an evaluation for treatment if they can't pay $100. And with addiction, I don't care whether it's cigarettes or whether it's opiates or whether it's alcohol, that it is the continued sort of access or reminder that treatment's available, that you can get out of this and that you don't have to be isolated. So it requires some contact to be made with that. What it doesn't do is, if you're caught robbing a store and you happen to have personal possession on you, you're going to be arrested for robbing a store and you'll have a civil fine for the possession. So if you're committing a crime, that is not going to free you from doing that. And I think that's one of the fears that some people have expressed as well. It's so it's going to be an interesting conversation, I really think.
Right. And tell me a little bit, and you know, you don't have to go into the sort of the deep ins and outs, but I think that a lot of folks will read the title of this bill and be really curious about what it means to have a schedule of alphabet, like schedule.
Oh gosh, you know, that's all the legal drug stuff.
Right.
We certainly changed the title of the bill to decriminalize personal possession. And we didn't go through the list of
Sure.
drugs. Yeah, but
is that essentially like all the basic drugs? And you know, one of the questions we have from Facebook is like, what about fentanyl?
Well, fentanyl is an opiate. And I think one of the concerns, quite honestly, is fentanyl is such a what's happening on the street is not everybody knows whether there's fentanyl in their drug or not. I mean, that we don't have control over. But if we look at the drug and that's personal possession, and if we know it's fentanyl, well, then because it is much more potent, it's going to be a lesser of a possession to count on that. You know, and if somebody is caught handing off their drug to somebody else, that's trafficking. Even if it's from one friend to another because they're sharing what they're doing. I mean, this isn't going to change that bit of it. The other piece is it isn't going to change the need also for drug court, you know, because many of the crimes committed with addicts end up being, you know, robbery or something like that, which will get them into it. And I think we still need that availability in terms of the ability to get people into treatment.
Sure. Speaking of that, you know, one of the questions we have here is, would it still be possible to have assessments even if someone can afford to pay the fine? So, or
we aren't requiring that right now.
All right.
One of the questions that has come up, though, is what if you don't have insurance? You know, who's going to pay for it? Well, a lot of organizations that do treatment will work with them to apply for Medicaid. And quite honestly, if they can get Medicaid, and that's going to give them the ability to continue treatment. Because, you know, if they don't have insurance, then they're not working at a place that provides insurance. They're probably not working. Or, you know, at a minimal level. So they probably qualify anyway. But again, it's the isolation, it's the not knowing what's available. It's so it gives that point of contact, which will allow them to really work towards what I consider the road of recovery.
Mm-hmm. What do you think are some of the key challenges or opportunities that this bill is facing in the legislature?
Well, let me see. When it first came out, I got a call from one of my local policemen who says, "What the heck are you thinking?" So, yeah, there's going to be some issues that go with that, and I think there are some tough experiences that go with that, and I think that's where education and discussion is going to be the important piece of it. We had a bill last session, 1492, and the Sheriff's Association actually was in support of that. So if you really want to look at, I think there's going to be a mixed bag, even in law enforcement itself, in terms of that. So that will be interesting to see. I think there will be a lot of discussion about the different types of drugs and how they're going to be able to work with that. But I firmly believe, and maybe I'm being a little Pollyanna-ish, but I firmly believe with some real discussion and some work at compromise, if that's what we need to do, to begin a look at how we really get people to treatment instead of jail, how we get people out of this cycle of addiction. And we can't do it by jailing them.
Have you engaged with the prosecutors or Prosecutors Association on this or the bill last session?
I have not, no.
I've talked with the Attorney General's office about it, and as soon as the bill language comes out, we're going to talk with the prosecutors. But so last session, the prosecutors came in and they didn't support decriminalizing, but they did recognize that the way we are doing things is not working and that the laws are pretty outdated in terms of what is prohibited and what's a felony and what's a misdemeanor versus what people are actually doing. And so the law should really reflect what's happening on the ground. And I think there was a real sense from prosecutors last year in their testimony that they were willing to admit that maybe what's happening on the ground is not reflected in our laws.
Mm.
Yeah. So that will be interesting. But I firmly believe we can do something, but it's going to take work. It's going to take a lot of discussion and time. Part of the frustration is we're all virtual, and being virtual is really difficult to do the kind of corner negotiations and persuasion and talking to people that you have when you're in the hallways, when you're going from one place to another, or just casual meetings that allow you to do the kind of advocating you want to do. So it does make it difficult, I think, being virtual. There are some things I like about being virtual, like
Sure.
at home.
when it's time to start making dinner, you're already
That's
there.
right. That's right. There is a time though when my cat will walk across my computer and sort of tell me, okay, you've been in front of this long enough.
Right, right. So, you know, I know one of the things that we like to make sure we check in about on these are, you know, what is the intersection with gender equity or gender issues on this bill? And I wonder if that's something that you've thought much about.
Well, I think there has to be gender equity, but I think one of the things, and I will say I worked at a methadone clinic for a period of time, and I also worked with Suboxone. And one of the things that I noticed the most is really women with addiction also have other issues of sexual abuse and violence that sort of go along with all of this. So there are some real problems. They, you know, and putting them in jail is not going to ease that at all. And I just got some information from Meagan regarding really what's been happening with women in terms of being arrested for drug crimes. And the number of women arrested for drug crimes has increased 25% compared to 3.5% increase for men. I don't know if that reflects an increase in women getting more into the addictions, or if it's just being picked up more readily. I really don't know that one.
Right.
And I think that's a hard piece that goes with it. The number of women incarcerated rose by 51% too, and that was from 2014 to 2019 as compared to men.
Mm-hmm.
And they're largely due to drug offenses. So I think this sounds terrible. So does that mean we're catching up with men? Or does that mean a new focus? And that's, a tough thing to go with on that one.
Right. I think that's something I'm just particularly interested in data and, evaluation. And I would agree. I have that same question about, do we know if it's more use or do we know if it's something else?
Yeah.
But what we certainly know is that even the Maine DOC reports that the vast majority of women who are incarcerated in the system are identifying as victims of trauma. So that, we're not just guessing if that's true. Like, we know that in Maine, 70 to 90% of women who are incarcerated are victims of early trauma. And we know there's a connection between trauma and mental health needs, between mental health needs and substance use. And then we continue to criminalize that substance use and possession, which
even more, right?
As a longtime sexual assault advocate, feels like criminalizing trauma.
Well, and I think the difficulty with this early childhood trauma, it takes away your sense of self and that sense that you have any control. And then with addiction, you lose all that control. And then it's just added to by being punished for that loss. And I think that's unfortunate. When I started working for the methadone clinic in my area, I did physicals on 200, the first 200 that came into the clinic. And I would say a good 75%, regardless of gender, had early childhood trauma. And that was an eye-opener for me. I didn't expect it to be so significant. So we need mental health access. There is so much that we need that you just don't get in jail. And I mean, jails are doing better, but we have police and saying these people don't belong in our jails, and they don't. They really need the help we can give them. We can get them into treatment and get them to the mental health services that they need.
The other lens, I guess I would offer in terms of trauma and sexual violence and then drug use and incarceration is that incarceration actually, significantly increases your likelihood of experiencing sexual violence. Less so for women, actually, although women going into incarceration are 30 times more likely to have been victims of rape. But men, LGBTQ people with disabilities are all much more likely to be sexually assaulted in prison, no matter what got them there. So it's another reason to keep folks out of prisons and jails. Sorry, that's my soapbox. You're supposed to be talking.
That's all right, I agree.
Question we have in the chat: are there similar drug sentencing bills, or really bills of any type, coming out this session that would complement this proposal? I
actually don't know, and not all the bills are out yet, and quite honestly, so this bill, I've worked on co-sponsors. We only have 3 days, so I don't even know how many I've got, but it's in. It'll be an LD shortly. And then we'll sort of have a better understanding, because once it comes out as an LD, I am sure that there are going to be more people coming out, either asking questions or looking at this for support, hopefully, on that part of it.
I do know I don't know of bills that have been printed yet, but I do know that there are several bills dealing with substance use and incarceration. Representative Jay McCreight has one about trying to connect people on probation with recovery coaches and trying to ensure that people who relapse while they're on probation are not sent back to prison for relapsing. I know that Representative Genevieve McDonald has a bill about syringes and not criminalizing syringe exchange and possession. That came out of the compromise last year on LD 1492. And then Representative Talbot Ross has a bill about trafficking and not convicting people of drug trafficking just based on possession of small amounts. So right now under the law, if you possess a small amount of heroin or fentanyl, you're automatically defined as drug trafficking, regardless of whether you were intending to traffic or you just had that amount on you. And so those are 3 of the bills plus this one that I know about, but I also know that there are other bills coming out. Representative Morales has a bill about criminalizing poverty and decriminalizing poverty, and I think drugs are part of some of what are in her bill. So I think you'll see it across the board, but those are just the ones I've heard of off the top of my head.
Great. And what do we think a timeline for this bill might be? Did you say, Representative Perry, that you're just getting it out of the revisers now? Yeah,
I got it earlier this week, and I've sent off to a few people, hopefully getting some co-sponsors. But if I don't get co-sponsors, I'm sure with the way this is going, getting people to respond back when you want them to, we only have 3 days to do it in. We'll see what happens, but it will be out as an LD shortly. probably by the end of this week.
And what else should people know or do if they want to support this proposal?
That's a good question. Well, I think as an organization, if this is something you want to support, I would testify to it. I think that is important. It also helps being a face seen in testimony. So, I mean, if that was something, that would be physically speak and testify to it, because that does mean a lot more. And you don't have to travel to Augusta to do it.
I think also letters to the editor can be really powerful to let other people in your community know that you care about this issue. That's easier once the LD number comes out so that people can look it up. But sort of letters to the editor last time around were a great way. We saw them pop up around the state, and it was just incredible to see the different corners of the state where people really cared about this issue. And if people want to share their personal story related to this, I'll put my email in the chat, and feel free to reach out to me and I can connect you with folks who can help with testimony.
All right, well, I think that brings us to 12:45. Any last comments that you feel like you wanted to share that we didn't get the chance to check in about?
Nope, except for follow it and get as many people to support it as you can.
All right. Well, wonderful. Thank you so much to both of you, Representative Perry and Meagan and the ACLU. So happy to have you here today. This will be available online and I'll be happy to share it out. And then for other folks who are watching in the Zoom room or the live stream, next week we will have Betsy Sweet from Moose Ridge Associates talking about how the state builds and passes a budget. So it's budget season.
We're working on that now.
Indeed. All right. Well, thank you so much. Have a good afternoon.
Thank you so much.
Good to be here.